welcome to those who are joining us virtually. Recognize board members Jan Morrell, Bruce Jardine, Doug Hurst, as well as our good partners in the association. Randy Baca, Barb, Cheryl, welcome each of you. Board, I want to kind of talk about two different things tonight and make this certainly an open forum to ask questions, because I want to make sure that you have good information on this. We've spent a lot of time the last 2 weeks getting prepared for the testing of high school students for extracurricular, not just athletes, it's extracurricular. So any student that might be involved in an extracurricular event, certainly that could be boys and girls basketball, swim, wrestling, but it can also be debate, choir, drama. If there is an extracurricular event, those students, by pursuant to the health order, would have to be able to show a negative test within the last 14 days.
Would that include like a CTE cognitive tech test?
If it's the real key, Robert, is whether or not if it's directly connected to the class, then it's not considered extracurricular. And so I know that Dr. Belknap is, aware of that, and there are some of those that will fall in the category of extracurricular, but there will be others that are directly connected to the class and won't require it.
Okay.
So there's one other thing I want to state at the outset, and we have our representatives from the association here. I think that some perceive that this public health order coming from the health department prioritized high school athletes more than teachers. And I don't believe at all that that was the intent, because I have spoken with state officials. They wanted to make very clear that this health order created a mandate, a requirement to test every 2 weeks. And they certainly didn't want to force teachers into that position, that they had to test every 2 weeks. So it was really out of respect to teachers and others that they weren't included in that mandate to test. However, our intention will be, if we have sufficient tests available, that if we've got some on our staff who would like to be tested, then we'd be able to accommodate that. So we'll watch that very carefully, and hopefully that comes in. But just I don't think that was messaged very well, rolling it out, and I can see how teachers and others could get the impression that student athletes were prioritized over them, but that was not the case. It had to do with not wanting to require mandating. We had this has moved fast, this testing mandate. And I asked if we could be a host site for training, and that training took place yesterday. We had representatives from Weber, Ogden, and Morgan who were attending the training yesterday. And what we will do with this is each high school, each of the 4 traditional high schools, will have a team of 7 each time we test. And that testing will be the first and third week of the month. Our goal was the first and third Monday of the month. However, we are not certain that we're going to have all the personal protective equipment in place from the state by this Monday. So this first round of testing may get pushed to maybe Wednesday or Thursday of next week. But for the most part, we'll try to do the first and third Mondays of each month. Now I know in January and February, the third Monday falls on Martin Luther King Day and President's Day. In that case, we just go to the Tuesday. Okay? That team at each high school will consist of 2 nurses, an athletic director, an athletic trainer. We have worked with the Ogden Weaver Tech College, and they provided us with 7 or 8 names of students who are in a medical related path who would like to participate. So there will be, 1 or 2 of them, an administrator. They're recommending an administrator is there to help oversee. So there will be a team of 7. The training is using a test called the Binax Now. And it's a swab in the nostril, but if you've been tested, and I have, it's not one that goes up as far. This one goes up approximately 1 inch. And we'll have a nurse that performs the test. That nurse will be in full PPE with disposable gown, KN95 mask, a face shield, gloves, and swab is placed in the nostril about 1 inch and turned 5 times. And then there's almost a little booklet that you put some fluid on and put that swab in and let it sit for 15 minutes. Some in the room compare it to a home pregnancy test. I've never taken one, so I don't know.
Makes 2 of us.
But within 15 minutes, it has a result. We will have one of that team will be a recorder, and the data will be input into a system called REDCap. Now, right now, we're having a lot of problem across the state with this REDCap account. It's been down all day today, but it's the database, essentially. Initially, that was a concern for me because this is a student record. And once you have a student record, then there are some legal obligations to protect that data and protect privacy. But the state has vetted this REDCap system, so that information will not be kept in our database. My student won't be kept in my student. It will be kept in this statewide database, REDCap. Okay? Should a student test positive with the Binax Now, what we're not going to do is, respond to a concerned parent that says, I want to be tested again and again and again. However, if a student tests positive on the Binax Now test, they have the opportunity within 48 hours of testing positive to go get tested, somewhere else. And it just slipped my mind, what's the name of the PCR? most tests that you're getting in the community are PCR tests. If a student tests positive on the Binax now, within 48 hours, takes a PCR test and it's negative, that PCR test is the one that is taken as official. It's considered a more reliable test than the Binax now. But that obligation would be on the participant, whether that's a coach, a student athlete, or whatever, okay? There was a grant that was released. I think it was $3 million statewide. And the grant had a $10,000 base for every district or charter school, and then a certain dollar amount per student. And the money can only be used for expenses related to testing, the Binax Now test. So we know this is a challenge to ask whether it's a nurse, an athletic director, or an athletic trainer to be put in this role. And so we're going to give each member of that 7-person team a stipend each day that they participate, and that stipend will come from the grant. The PPE is all coming from the state, but we don't have it yet. And that's what is a little bit concerning about this Monday. In fact, if, the reality of it, I just don't believe that we're going to be able to test this Monday. I think that first test will be later next week, and then we'll be able to get more on that first and third Monday routine, right? What questions do you have about this? Have any concerns? Have you had questions from constituents?
I would suppose with that red cap system and the confidentiality that covers in with HIPAA and everything else, so that there's no problems. And so if a student tests positive, they will contact the parents.
Yes, we'll bring the student down. So as students are coming in and testing, once they test, once they're swabbed, if you will, then they just exit. And this will be a very formal kind of process where we're able to maintain proper social distancing and so forth. But Paul, once they're swabbed, once they're tested, they'll leave. And we'll go through that process then of contacting their parent and the student regarding a positive test, and explain to them that if they question the validity of that result, that they have the option to go get a PCR test within 48 hours. Okay? Robert? Good.
What if they refuse? What if the student, I don't want to take the test?
They don't participate. They don't participate. So we can't force them to take the test, but they just don't participate in the activity.
Okay.
Do we need a policy, or do we have one, or are we just, what's your thought there?
Well, it's on the health order. We're just simply following the health order. So I wouldn't recommend that we have a board policy.
We need some
related to it.
flexibility, I'm just saying, in order to do that.
Yeah, we're following the public health order.
Perfect, we just need that out there.
Yeah.
Dr. Stevens?
Yes.
Real quick. So our employees that are doing the testing, I heard you say that they would be, for a better word, garbed up. But we won't know if they have been exposed quickly enough to know if they are transmitting that. Is Is that, am I wrong on that?
I'm not following your question exactly. If who's been exposed,
So let's say that they
the 7-member team?
they encounter a student that is positive, but within 15 minutes, I assume they're going to test another student.
Yeah, let's go back to now, Jan. I think I hear your question. I think I understand your question. Let's talk about the definition of exposed. They would need to be within close proximity for 15 minutes.
Okay.
We're talking about testing with this team of 7. We're talking about testing 2 to 3 students per minute.
Okay.
Per minute. So a student that comes through, first of all, each member of that 7-person team will be wearing personal protective equipment. The level of that PPE depends upon what they're doing. For example, the nurse who's swabbing will be in the most PPE. At the very end of this, there's a recorder. The recorder isn't even ever close to the student. So the recorder will have some PPE, but not as much as the nurse who is conducting the test. Does that make sense? So there's never a period where any member of this team would be in contact with a student for even 3 minutes, let alone 15 minutes. I mean, this will move swiftly. But again, I hear what you're saying. It's the reason why we're using the grant money that we've got for stipends. You know, this is a responsibility that nobody signed up for. A nurse, an athletic director, an athletic trainer, you know. So we feel like certainly it warrants, and all the other expenses, quite frankly, are being covered by the state. The tests are being provided. We already have the tests, which we estimate will get us through the month of December. We have enough tests right now, and Gina and Clyde have distributed those to the 4 high schools. We have enough tests, we estimate, to get us through the month of December. Right now, we don't have the PPE.
It's the same type of testing that is done, like, in a rapid test if I go to Walgreens. Is it a similar process?
Similar, except for the penetration into the nostril, to be very, graphic, is not near as deep. You're only going up. I went to the training. The minute there's any resistance, you stop. So they're just not going up deep into the nostril. It's just about an inch up, and then you twist it, and that's how you collect a sample.
The other ones that they do are extremely long.
This one's not.
The swab is extremely long.
This one's
Yeah.
probably about that length.
There you go.
I guess my concern is for our employees who are doing the testing, but I understand that that's safest that can be insured at this point. I understand that.
The person that was there from the has worked with the CDC and is from the state, and he, assured people that their experience is that this is a safe environment, this is a safe protocol. And we made sure that we had teams from every high school present. All our nurses were present. And they're the ones that are going to be performing the tests, and I want the nurse being the person that is putting that sample in the booklet so that it is tested, if you will, by someone with a trained medical background. And we'll have members of that team doing other kinds of things. To keep this moving, they recommended a 7-person team. But some of them are more at risk than others. And
If we were to have a medically fragile person on that team, could they opt out?
They've all volunteered.
everybody who's a participant has volunteered, Jan.
Okay, thank you.
Yeah, we're not forcing anybody to do, we will not force anybody to do this.
Thank you.
Anybody else have a question on it, Dean?
I do. Will all this testing affect the number of students that the school, when it reaches 15 right now, it goes into closure? Will that number change?
This is a great question, Dean. I think, let me, first, what I'd like to see change with the frequent testing is the quarantining as it relates to the group. So I want you to think about a basketball team, for example. If you've got one positive case on a basketball team, and that person tests positive, it'd be almost impossible for the entire team not to be considered a close contact and therefore quarantined. You'll never get through the season. You'll never get through a season that way. I think that there's discussion about relaxing the quarantining for these participants due to the frequent testing. Because they're testing every 2 weeks and they have to show a negative test to participate, then there's not the worry that you may have been exposed, therefore we're going to quarantine you to see if you have symptoms. Because every 2 weeks you'll be testing them. So there's a lot of discussion among superintendents and state health officials about that. Right now, I haven't heard anything about the school number being reduced from 15.
The suggestion went the other way.
I visited with Weaver High School, with a teacher at Weaver High School, and the feeling that this person had was, we have 2,000 students in our school, and 15 out of 2,000 came up about 0.75 or 6%. And it's easier to reach 15 if you have 2,000 that you're checking than it is if you have, let's say, 1,500 at Bonneville. So the question that they had was, do you think, and I told them it wasn't us, it was the health department that set that figure. We didn't have anything to do, we've just been adhering to what they said, but at least 1% of the student body instead of 0.76 of every student body. So that Weaver High School would have to reach 20 before their quarantine. I've heard that there's going to be some changes in the elementary schools. Maybe that's not true, but either way.
Let me just respond to that, Dina. Here is one where, as a board, I just remind us as a board, we have followed health guidelines. We've not got into trying to make those kinds of subjective decisions because we haven't felt like we have the expertise. So should the CDC or the health department come out with different guidelines around school closures and the number, the threshold to reach in order to close a school, I think I would recommend to the board that we absolutely follow that. But I want you to think about another thing. You're trying to balance. You're trying to balance maintaining in-person school, but also provide that safe school environment. And it's done it. I have been, one of the things that I have been so impressed with this year is the result of the school closure. When we had, our first one was Roy High. We saw them start to spike toward the end of September and into October, and they went into a soft closure, and the numbers just went almost right to zero by the end of that 2-week period. They've been very effective now. Certainly, it's a little bit disruptive to close down school and move online. Although our teachers have become so adept with the Google Meet link, and so I know, Dean, 2 weeks ago, I think I was out at Weaver High while they were in school closure, and I helped teach one of the classes. And every student was present, virtually, every student. I went into another class, and there was only one student absent. So school has been able to go on, but the important thing is the number has come down. And so it's a balance. I hear what you're saying, but the more, from my frame of reference, the more you increase that number, now you start putting at risk more the opportunity for spread of the virus. So I've been pleased with the 15. We've adhered to that with exactness, and it has been successful because at the end of the 2-week period, you know, the numbers are almost zero, and so it's been helpful. However, that being said, if we get new guidance, I think we follow that.
We have to.
I think we may be getting some new guidance based on something that came from the CDC this week, where they're limiting quarantining
Yes.
to 7 to 10 days. Now, we don't have that yet from the state, but I would be surprised if that comes. And if it does, I think we follow it.
I agree.
Thank you.
I have one other thing I want to talk
Please,
about.
please.
We had in place an equity director, Lillian Sosi Jensen, and she has been outstanding for our school district. She brought so much expertise and experience to our school district for really a lifetime of work in this area. She separated from our district as of the end of November, and it was on good terms. She's a quality person. We wish her the very best. Her influence in Weaver School District will be felt for years to come. We benefited from her work over the last almost 2 years in our school district, and we thank her for that. We brought our equity committee together, and we opened a position for equity director. And later this week, we will interview 6 finalists. I think there are 3 in district and 3 out of district. But this is important work. I think that the pandemic has in many ways heightened the importance of this work. Tonight, we'll be privileged to hear from the president of the local chapter of the NAACP, who requested to be on our agenda tonight, and she wants to make a statement of support of the effort that our district has been going through with equity, including our equity committee and the goals and standards that we have set there. But I just want to let you know that although Lillian has separated from Weber, we're gonna move forward. That equity committee has met, probably 3 or 4 times in the last 6 weeks, and they're remarkable. We've got members in here, including Brandon and Barb and Lori and so forth that represent that committee. But we'll move forward, and our hope is that we have someone back in place by January. Okay? President, that's all I have.
Thank you, Superintendent. Board members or virtual or in the room have anything before we take a 9-minute break and we start at 6? If not, we'll have a 9-minute break. See you in just a minute. Thank you.